There we go.
We're good to go. Thank you.
All right. Good afternoon, everyone. Welcome to your TSJG Neighborhood News. Today is May 28th, 2020, and I am Jessica Lopez, your host this afternoon. So as a reminder, as we do our Zoom calls, please mute yourself when you are not talking. And as I go through my presentation, please use the chat feature and ask any questions that you might have, because one of the directors will unmute themselves and ask that for you, or feel free to unmute yourself and ask as well. And as a reminder, all of the background noises can be heard when you are unmuted. So thank you for your participation in our Zoom call. So a COVID update, as we always start with. So Fresno County shelter-in-place update. So as you know, as of May 26th, the shelter-in-place order ended. So businesses were able to resume, including restaurants, beauty shops, as long as they meet the requirements, and churches have now subsequently been approved. So I'll talk more about that. This really has changed nothing for us operationally at TSJG. And that is because we are also regulated by the state of California and the Department of Social Services, who will give us guidance on if and when we can open our beauty shop, some congregate activity, including churches, the use of the gym, etc. So I'll share more about that momentarily. So we do really encourage you to continue to wear your mask. The Fresno County guidelines still say that folks are highly encouraged to wear their masks, and many essential businesses like ours are requiring people to wear their masks as protection for their customers. So we fall into that essential business realm, and we do ask that residents wear their masks when out and about outside of their apartments. And why do you want to wear a mask? Well, we now have very clear evidence that wearing masks works. That's not words, that should be works. That's my typo. I'll fix that once we're done today. It's probably about a 50% protection against transmission, according to Dr. Chris Murray, director of the Institute of Health Metrics and Evaluation. So really what happens as we unshelter in place as a society will be determined based on how people do some very basic things, like wearing that mask to protect themselves and others, following social distancing guidelines, and of course, hand washing. So for Fresno County, our update as of yesterday afternoon, total cases, 1,631. Of those, 55 are travel related. It's been interesting to watch how when I first started doing these reports, they were all travel related, right? And now it's the smallest number. 728 are considered close contact, which is usually family to family spread or people within the same household. 622 are community spread or unknown, meaning somebody was out and about and was infected with the virus, and there's no real unknown point of origin as they've done contact tracing. And 226 are under investigation. Total deaths since they've begun tracking COVID has been 30. The individuals that have been hospitalized at one point, 190, and 519 have recovered. So to date, the total individuals being monitored by Fresno County Department of Public Health is 353,557, and those that are currently being monitored are 815. And so those are individuals that have been asked to self-quarantine and or individuals they are doing contact tracing on. So what does it look like in Fresno County? This is the most updated surveillance board. So it's a visual representation of what I just verbally recited to you. So you can see there the largest number of cases remain those from the age of 18 to 49 in Fresno County. Those over 65 is about 230-ish according to the graph there on the bottom left-hand side. And then you can see on your right-hand side of the screen the dashboard that's updated that is tracking COVID information to date. So the yellow line is the total positive and then the total new cases at the bottom, that blue line. So as they've been tracking since March 23rd, you can see that escalation from 0 cases, up to what does that look like, closing in on 15 to 1600 there. So 1535. So it's just interesting as you've seen that graph change over time. We haven't seen the drop off. It's still growing, but it's not growing exponentially as was feared when they were predicting the great surge. So there hasn't been a great surge yet, but we're still on that upward trajectory. It'll be really interesting to see over the next several weeks post the release of the shelter-in-place guidelines, and as businesses resume, and if people go back to their habitual behavior and not adhere to some of the guidelines they put in place, what might occur in this graph. So we'll watch this dashboard very closely on our calls together weekly. So looking at California overall in terms of the cases, Los Angeles obviously having the greatest population, such a great geographic area as well in terms of size. They have the most positive cases, which is not surprising with over 45, almost 46,000 cases. So substantially larger than any of the other counties in our area. And you see Fresno, again, as being one of the largest. I think we're the 5th largest city in the state of California, but we're still, down there with a total cases of 1,496. So that's obviously where we want to be, on the lower end of that poll. So just, I think, interesting information for us to share in terms of how many positive cases by county and where Fresno lines up in comparison to some of the other counties. So for San Joaquin Gardens, our current statistics as of today, we have 0 positive cases. We currently have 2 team members who are considered PUIs, or persons under investigation, and those are 2 individuals that have been tested for COVID, and we are awaiting their results. So they are off campus, sheltering in place at home while we await for those results. Our cumulative data at San Joaquin Gardens, so again, total positive cases to date, it still remains with 2. Both have since recovered. One was a team member, one was a resident. Total PUI cases to date is 50. So we've had 50 individuals that have been tested since we have been tracking those testings. And then of those 52 were positive. So that's what, a 4% rate of positive cases to testing. So remarkably low. So, again, all of the measures that we're putting into place in terms of screening our team members and limiting visitors and all of those other things that we've done has really helped protect the COVID infection rate. So again, a gentle reminder of COVID-19 symptoms, and I'm going to remind us of this on an ongoing basis, because as society goes back to normal, the fear is that people will be less aware and of these symptoms. And as you saw in New York and some of these other areas, this community spread really came down to people that were symptomatic, out and about, and shedding that virus to others. So it is so important for us as a community, for our team members to be screened daily and to talk about if there is a fever, if there is a cough, shortness of breath, chills, muscle pain, sore throat, loss of taste or smell, and or gastrointestinal symptoms, including nausea, diarrhea, or vomiting, to let us know. Now, again, you might always have a cough. You have COPD, and having a cough is normal for you. You know your body. So really what we're looking for is symptoms that are not typical for yourself, and to let us know. And when in doubt, shout it out. to us. We want to know. So the more informed we are, the better we can protect our neighbors and this community. So any of these symptoms, please let us know so that we can have our nursing team work with you and your primary care physician to make sure if you need testing that you get so, and that you remain in the apartment until those testing results come back.
Jessica, it's Cynthia. We had a question in our Zoom. A resident is asking, what departments are the 2 PUI team members working in, and if we can release that information?
I'm trying to remember. One is in security, and the other, Cynthia, do you recall?
I want to say it was home care.
Yes, it was home care.
Home care. Okay, thank you. So one team member in home care and one team member in security. Thank you. Excuse me. Oh gosh, so sorry. So again, nothing has changed. While society is going back to normal and businesses are reopening, I don't think I can reiterate this enough, which is there is no normal. COVID is still out there. But I do believe personally and professionally that we do have to find a semblance of normalcy. I don't think it's healthy for us physically and psychologically to be, so isolated and that we have no interaction with others. I think we have to strike a right balance between those things. And so as we look to regain some normalcy, we look to regain some of what we know and love about our campus, we still need to remember to have effective physical distancing during our interactions. You're going to see a lot more physical markers go up throughout campus that is encouraging physical distancing of 6 feet. We really want to encourage each other to wear masks, and I know that is really difficult on a 107-degree day. And those of you that saw me out there yesterday, running through Tuscany, delivering, what was I delivering yesterday? Macaroons in 107-degree heat. It's not easy wearing a mask, on those hot days. So some of those days it might just be best to stay home, but those masks are going to really be helpful for us to protect against COVID. And just really be diligent about hand washing, sanitation, touching things and others, and then obviously reminding others. Just a personal note, today was the first day I physically have gone anywhere outside of coming to work and home, and I had to go get, I have an infected finger, so I needed to go get that taken a look at. And I went to an urgent care when they first opened so that nobody else would be there. And when I went in, it was a place where they would allow testing for COVID. You had to remain in your vehicle for that. But the team members that worked in the urgent care were not wearing masks, and they kept encouraging me to come stand next to people, to come and sign myself in. And literally there was no space for me to stand except for and I said, no, I will wait. But, again, I'm so proud of us as a community, how well we are adhering to these 6 feet markers, et cetera, because the greater, even in healthcare, in the greater community, people are not adhering to some of these norms that are going to be so important to protecting all of us from COVID-19. So it just was shocking to me because I'm so used to being here and seeing all of the team members wearing surgical masks, seeing our residents wearing their cloth masks. To walk in and see somebody's face without a mask was shocking to me. Now, they eventually did put them on, but it was shocking to me that they didn't have some of these protocols in place. The only other place I've been during this entire time was Costco, and they did a great job of it. So it's a little scary that an urgent care wouldn't be as diligent as Costco was. Again, want to remind folks that and Valerie and I were actually just talking about this morning, that she was reading other articles that really are predicting that we could have a vaccine by December 2020 or January 2021, that there's lots of research, lots of positive data out there showcasing that some of the trials that are currently in place, and they're at human trials right now, are really positively viewed at this point in terms of the success rate. So for all of us to continue to hope and to pray that we can eradicate this through a vaccine. So again, Dr. Anthony Fauci has predicted this, and obviously he's one of the closest people to it, but other affiliates and news outlets are showcasing the same thing, that they feel confident that we could have a vaccine that early, which is a lovely thing considering the original predictions were, I believe, 18 months out for a vaccine. So this is quite important. And boy, whoever buys stock in that institute that creates the vaccine is sure going to see a skyrocket there. So again, I know this is not new information, but I think the adage is you have to hear something, is it 15 times or something before you'll remember it. So I just want to keep reminding us that the CDC recommends washing hands with soap and water for at least 20 seconds, that each time you do it, you dry it with a clean towel. And that's something that we don't always think about, because we might just use the same dish towel every time in our kitchen when we wash our hands. So, you know, maybe using paper towels and some of the things that we historically didn't do because of the environment right now we really want to do for infection control purposes. Somebody gave me a cartoon of the family circus where the mom was instructing her son on how to wash her hands, and he said, "Gee, mommy, I'm not going to perform an operation. I just want to have lunch." Well, right now we have to think of all of ourselves as we're going to perform an operation, and that means we need to do a really, really good job washing our hands all the time. So again, after using the restroom, blowing your nose, after coughing, sneezing, and really after any interactions with individuals. So when I went to the urgent care today, I was hand sanitizing while I was there. Before I went in, after I went in, I was very conscious of not touching my face, of staying away from others. We just now have to live that life where we're very aware of ourselves in this time so that we can protect ourselves and others from COVID. So again, our best defense is folks staying home when sick and physical distancing. So this, although there is some community spread that can happen through contact with surfaces, the primary way COVID-19 is spread is through respiratory droplets. It's when a sick person coughs, sneezes, or speaks, and somebody is within 6 feet of that infected individual, and they breathe in that droplet. So that is why it's so important for you to wear a mask, because when you sneeze, it is captured in that mask. It's so important for other people to wear masks because it diminishes their ability to inhale that sneeze. So just really being aware of your physical distancing, and please, please, please stay home if you are having any symptoms, but if you're not staying home, wear that mask. So it is just so important that we all, as a society, but especially here at San Joaquin Gardens, adhere to this, because we know our population is at the most risk of COVID-19, and we want to make sure we're protecting each other during this time. So again, another slide talking about the importance of physical distancing. And I know I shared this with you all on Monday, but I want to go back to it. It is, you know, if you're visiting with folks and you're staying 6 feet apart and you're outdoors, and again, probably not today, but it's going to cool down over the weekend, because you're outside where the wind and there's all this infinite outdoor space where that sneeze or that cough will be diluted into, there's less risk to others. So if you want to, if there is visiting happening with friends, or if you're going off campus, you know, to see your family, it's so important to try to do it outdoors if possible, because those are going to be the least likely for you to contract COVID-19. There's studies being shown that sunlight and the importance of vitamin D and how that interacts with COVID, and it helps your immune system. So it is okay to go outside in the early morning hours and take a walk. It's important to get that vitamin D, so to speak. So physical distancing is still important, even outdoors and even with masks. So we put these throughout the campus. A resident came to me and said, you know, when we're out and about, our norms take over. And, you know, when you see a bench and you go sit next to somebody, you're not thinking about the fact that no two people could sit on this bench and be 6 feet apart. So again, practice safe physical distancing, remain 6 feet apart. 2 members from the same household can stay together because they're going to be closer to each other than that 6 feet. So there's no need for physical distancing from one another if you're within the same household. And just some physical reminders. We are looking to create some great, what would you say, marketing pieces for our residents to show what 6 feet really look like, because I think a lot of people think they're standing 6 feet away from someone and they're not. So, you know, my wingspan is 6 feet and I'm 5'11". So it's basically 6 feet. So when you think about a couch or a dining room table or a bed or a doorway, that's 6 feet. It's a pretty big distance. And so when you think about, you know, our normalcy as we go through campus, try to keep some visuals in your mind for how close you're getting to folks. Because even if they're wearing a mask, you know, it's important to keep that 6 feet distance. And again, a reminder to everyone that wearing your mask means covering your nose and your mouth. If you pull it below your nose, that's not protecting anyone from a sneeze. If you pull it all the way down when you go to talk to someone, that's obviously defeating the purpose of wearing a mask to begin with.
Jessica, we had another chat come through just about a reminder of cleaning our masks. If you can talk about that, how often should we be washing them, that sort of thing?
So the recommendation is to wash masks at least once a day. When you're not wearing your mask, you know, keeping them in the sun, they say heat can, you know, kill as well. If you wanted to in between uses, but the recommendation for cloth masks is to wash at least once a day. Now, that being said, if you sneeze into the mask or something, you probably wouldn't want to re-put that on an hour later if you haven't washed it. Again, a reminder that if you have any of the symptoms we discussed before, or if you have decided to get tested for COVID, please contact Valerie Epps and Carol Freeman to let them know so that we can track your results. So the most recent update from the governor, he basically announced that he was creating a whole new stage. So stage 1 was the shelter in place called the Safer at Home order. And that's when they were tracking all the data. They shut down as much as they could in society except for essential business, and everybody was asked to stay home. That was stage 1. Stage 2 was opening up a little more retail. Typically it was for curbside pickup and other things. And now he's added stage 2.5, which is allowing churches at 25% capacity, salons if they follow certain guidelines and restrictions, and restaurants to reopen. So he kind of invented a new stage or a stage 2.5. They're not fully here. So healthcare in stage 2 is starting to reopen. So if any of your primary care physicians shut down and did only telehealth, some of those are starting to do a little more in-person office visits, but a lot of them are saying you have to sit in your car until you can come in, etc. Restaurants, I've had a few phone calls from residents asking if they could go to a restaurant. And my answer is this. I cannot regulate what you do off this campus, right? We are not the police. We're not here to monitor what our residents do. But if it was me, knowing that this entire county has been sheltering in place, I feel like it's going to be a little bit of a madhouse for a while in terms of people that either don't believe in COVID or think that this is, you know, more politics and it's not really as dangerous as it is, are going to be out and about in force. Potentially not following some of the guidelines we just talked about in terms of wearing masks, physically distancing, you know, hand washing and other best practices. So I personally would not recommend going out to restaurants and at this time, but that's really a personal decision on your part. And just as a reminder, you know, you are in a group as a resident here. Most everyone's over 60, so therefore in a group that would be considered more at risk. So it'll, for me, the next few weeks as we watch the county's data, and there's a little bit of lag time in their data, but to see what this does in terms of number of cases, and especially in terms of what this does with hospital capacity. My husband works at the hospital, said they had the highest number of COVID patients at community hospital this weekend, and also the highest number of fatalities in their hospital this weekend that were COVID related. So, you know, there's still definitely an uptick. Now, our numbers aren't near what we've seen in other counties. You know, so I do feel that safely and cautiously, you know, we do need to get out of our homes and experience life, because I do see depression and other things having a far greater health risk, but we have to do it cautiously. And so my counsel and my advice to everyone is to be very cautious as you look at the greater society reopening. As San Joaquin Gardens reopens, we will do so slowly and cautiously, and we will do it in a manner that allows for social physical distancing and as well as all the other elements we talked about today. So I've talked with some colleagues, or they're not my colleagues, but some individuals that work at school
Jessica,
systems.
excuse me. Elaine, can you shut your video off? Thank you.
Okay, so there still is not a lot of guidance out in terms of what the school district will look like when we go back. The guidance on churches reopening was the first openings that had a capacity associated with it. So if you remember when you read about the churches reopening, they were allowed to open at 25% capacity. In most cases, that was the first time that verbiage has been used. So it'll be interesting as we look at some of these other venues as they reopen. Will they go to a percentage of capacity as their guidelines in reopening? As we look at reopening, we're looking at protecting a vulnerable population, which are our residents who are over the age of 60. So we have to develop protocols to keep our team members and our residents safe. Our public health has done such a great job of contact tracing, of getting folks to test and to shelter in place. They've been really proactive at testing people. We've seen that firsthand at San Joaquin Gardens, where they, you know, are testing people beyond those that are even symptomatic, etc. So they've done a really great job. But what I want to remind people is, you know, we may be in stage 2 to 2.5 right now. As a society, they may revert back. You know, if our cases go up, they will definitely revert back. As San Joaquin Gardens looks at going to our kind of next stage of quote unquote reopening, we could easily revert back. So what I want the message for all of you to hear is, as we go to grab and go dining, as we look at having some small controlled group activities in the future, if we get DSS approval to do so, that we may do that, but have to revert back to a previous sheltering in place guidelines based on any COVID activity within San Joaquin Gardens, which I'm sure all of you expected and understood could happen, but I want to make sure we dialogue about that, because this isn't going to be a linear, okay, now we're slowly going to move back to normal. There's going to be ebb and flow and fluidity that happens within this campus as we protect ourselves from COVID-19.
Jessica, we had a question come in about going out in restaurants. Is there going to be a quarantine after we go out for a restaurant, a time frame?
Thank you. So legally, I am not allowed to quarantine anyone. So I want to make sure we're very so residents have rights, and I cannot violate those rights even if it's during a pandemic. So if a resident chooses to go out to a restaurant, there is no contact tracing that I'm going to do, or no requirement I'm going to have for them to self quarantine. Really, the only provision that I have with residents is our contract, right? The care and residency agreement, which essentially states if somebody was going out and purposely negligent and creating an unsafe environment for our community as a whole, then I could step in and say you're in violation of your contract, of your care and residency agreement. It would have to be really egregious. Going out to a restaurant while wearing a mask while social distancing isn't egregious. To me, that's a personal choice. But somebody that's going out and doing, I'm trying to think of what could be possibly, but just being very egregious in their behavior in terms of inviting themselves to get COVID-19, and then thereby coming back on campus and interacting with others in a way that made them not feel safe, to where they felt like they could get COVID-19. That would really be the only way that we might step in as San Joaquin Gardens or Human Goods. So that is a personal decision. There is no quote unquote quarantine that would need to transpire post them coming back from a restaurant. And that would be true of any off-campus visit. And in fact, we've instructed our security screeners that we're not allowed to ask our residents, where have you been, what have you been doing, what have you eaten today? When they're coming through that screening tent, we should just be, our job at that screening tent is to verify that only residents and essential team members are coming through the gate. That's the job of the screening tent. It is not to determine where a team member has been, because that's really not our right to know. So Fresno County Health Department, so what they're looking at is, I talked about this, but the potential for a second wave or a surge as society reopens. They are seeing a decreased compliance in Fresno County of people following quarantine instructions. So somebody is known to have COVID-19 in the greater Fresno County area, and they're telling them you must stay at home. People are adhering to that like they were. They're looking at helping all of the essential employers create unique barriers to contain COVID, keep it out. They see a disparity in health access in terms of COVID outcomes. That's not shocking, but people who have access to healthcare are faring better than those that don't. And then they are seeing non-directly COVID-related activity potentially linked to the pandemic response. And what that's alluding to is depression rates and increase in suicides, opiate use, etc. So the shelter-in-place restrictions are beginning to be lifted in varying degrees depending on the city and the county. We see that locally with restaurants reopening, salons reopening, and religious services reopening. So again, in the greater Fresno Clovis counties, we're seeing all of this. Again, we are regulated by the Department of Social Services, which means they will give us guidance by which we are allowed to reopen. Human Good has proactively scheduled a meeting for tomorrow with the Department of Social Services, specifically to advocate for residential living. So in California, unlike other states, our residential living is regulated similarly to our assisted living. Outside of California, independent living, or residential living, what we call, is not regulated. There's no regulations that apply to independent living or residential living. In California, they do, but the problem is when something like this occurs, they are regulating all of our independent living residents or our residential living residents as the same as they would assisted living. And there's not a lot of similarities in terms of assisted living is more true communal living versus, in independent living or residential living, y'all are living in, I would say a more residential space, right? Like condos or houses, whatever you might call them. So there is a difference in terms of potential for COVID community spread. And because of that, Human Good would like to see some restrictions lightened for residential living, which would allow for our salon to reopen, for our some activities to occur. And so they're going to lobby hard for residential living, that if we can safely demonstrate that we can provide some of these, what we consider to be essential services, which would be like communal activities, things of that nature, that they would allow us to do so, both in residential living and in assisted living. If we can demonstrate that we can do so in a safe manner, that folks need to have that, just like people need to have food and other things, that it is essential to quality of life to have to do that socialization and have that activity. So they're meeting with them tomorrow. So by next week, I should have an update for you all in terms of what the Department of Social Services is saying for our operations. As I mentioned on Monday, we have quite a few residents say they'd be willing to serve on the Environmental Design and Infection Control Committee. So many that we limited to, I believe, only 3 individuals because we do want to move forward rather quickly. And these residents will really just work with myself and the leadership team as we look at what dining will look like in the future activities, visitation agenda, pools, etc. It's not really developing the policies. All of those policies will be developed by Human Good overall, but it's personalizing those in a way that makes sense for San Joaquin Gardens and allows for ease of use. So we thank you for those that volunteered, and we'll be contacting those who will be asked to serve on the committee. But again, there's no changes to our current restrictions. As soon as the governor gave the most recent update saying that we're moving to this new stage, we got inundated by phone calls saying, okay, can we come to visit now? Can we come to visit now from your family members? And the reality is that hasn't changed. The state has not said we can release restrictions to allow visitation on our campus, and that is obviously because of our population being over 60 and being more vulnerable. So more to come on that, but as of now, all of our current restrictions continue. What's going on in dining? Well, so phase 2 of dining in San Joaquin Gardens will be commencing, and we are hoping to have this go live a week from today, which is June 4th, 2020. That date could change based on us getting some of the items we need to put in place before then, but this would allow us to allow residents to pick up lunch and dinner if they so chose in the Monte Carlo or the Bistro. There would be a designated reservation time for pickup, and then for those that didn't want to opt to that, we can continue room delivery. But the purpose of this is to provide a safe alternative to room service so that residents can resume some normalcy. It would also allow for groceries to be picked up with the option for delivery as well. This will be coming out to all of you shortly, so there's no need to take notes. We'll be providing this information in many formats, but essentially this would say for last names that begin with A through D, you would be picking up in the Monte Carlo from 11:30 a.m. to 12 p.m. and dinner from 4 to 4:30 p.m. and it goes on from there. And this is to obviously control crowd and to ensure so that we can ensure that there's appropriate physical distancing between residents as they pick up meals. So this would continue on until we move to phase 3, which would be to open dining venues at a certain capacity and allow seating in the dining venues. Would be the next phase. So that would be phase 3. But right now we are moving to phase 2, which would allow residents to pick up their meals for lunch and dinner should they desire, and they would be picking up those meals based on their last name, either Monte Carlo or the Bistro. This kind of walks you through, and again, you don't need to memorize this, but if you were picking up the Monte Carlo, one of the things that we had to establish is not only crowd control measures, but to ensure from an infection control standpoint that there wasn't going to be bottlenecking or the potential for residents congregating as they were waiting to pick up their food. So we actually will have these arrows and these footprints on the ground in both Monte Carlo and Bistro so that you would know the path to follow, to walk, to pick up your meal, and to exit. And then where the footprints are would be where you'd be standing, which would be 6 feet apart from the other person as you waited to go and get your meals. So this would be actually on the floor for you to follow. So again, this will be sent out to all of you, but this is kind of walking you through how somebody would enter and exit the building so that we can, again, prevent that overlapping. Same thing if you're picking up in the Bistro, which is in our Piazza building, there will be markers on the floor indicating the flow of traffic and where to ensure you are 6 feet apart from another. And then again, for the Bistro, where your last name is would determine when you were picking up in the Bistro and at what time.
Yes, we had a question about the lunch pickups. If residents use the evening lunch at an earlier time, their scheduled time is at a later time, would there be an option to come earlier?
At this point, no, there would not be, unless they opted for meal delivery, but I don't know what time meal delivery goes out. So you could contact dining, but if we start doing one-offs on that, in terms of it's going to get convoluted, and we really want to make sure that we have crowd control measures in place, and so we don't want to move from that. But there might be a possibility of having their meal delivered earlier, because if that's when meals are normally delivered, that might be somebody that might opt for meal delivery versus pickup. So you've all seen the upcoming menu as well as the alternative menu that's still available for you. This is a more up-close depiction of the graphics that you will see on the floor as we help folks to socially or physically distance from one another as we go to this new normal in our dining venues. Father's Day is just around the corner, and so wanted to give you an update on what that meal will look like, which it looks like a really good one, which is tri-tip chicken, apple sausage, and barbecue shrimp, au gratin potatoes, broccolini and mushrooms, ham and corn chowder, a wedge salad, and chocolate mousse cake with a bourbon caramel sauce. So happy Father's Day to all of our dads out there. You got a great menu to look forward to on Father's Day. Wednesday, June 3rd is National Cheese Day, so we will be providing a bunch of stuff that I can't say. I can say cheddar and Tillamook, house-made something, Boursin with fresh or smoked Gouda cheese, port, wine, fig paste, that's some, and Marcona roasted almonds. So I don't know what any of that is other than the cheddar cheese part. That's the one I know. But I hope y'all are excited about having some fancy cheese because June 3rd is Fancy Cheese Day, and we'll be headed your way. Again, a reminder about all of our life safety systems. A big thank you to everyone for pressing your census button each day, and we appreciate that. And reminder for wearing your pendant and your pull cord. Again, we are no longer accepting verbal verification that you are okay over the phone. We are asking that residents go and press that census button each day so that we have confirmation that folks are up and moving and doing okay. So on Monday, we talked about this and how to press your census button. So again, you press your census button from 5 a.m. and 9:30 a.m. When you're pressing that button, you should see a red light flash briefly after you press the button. And Brian, I'm going to stop sharing my screen because you're going to do a physical demonstration of how to press your button. So Brian, are you there?
I am here. So everybody see the census button here?
Yes.
Okay, perfect. So what you need to do is you need to press the census button. And it's going to make a lag on me because, hold on. There we go. So you'll hold the button down for 1, 2, 3 seconds until the light blinks, but this one is arguing with me.
This is probably what's happening with the residents when you said it.
There we go. Okay. So it's a test dependent button. Everybody see the light blink? I know it's kind of hard on the screen, but you hold it down until that little red light blinks 3 times, and then that ensures that the census button will register. If you don't see the light blink, that means that the census button did not send a signal out, and you want to press it again until you see the light blinking 3 times. If you don't see the light blinking, then the best thing to do is call concierge, let them know that you press your button and the light is blinking. They will place a work order, and one team will come up and verify that the battery's good and check the device and make sure it's working properly.
Thank you, Brian, for that easy and simple overview of how it works in the technology room. So I'm going to go back to sharing my screen. And so again, just keep pressing that button until it will flash back at you in red the 3 times. If it doesn't, let us know. But we thank you for your willingness to use this device to assure us of your being okay. What's going on in building and ground? So it's a button here, that's for certain. So if you notice your AC is not working, it's not blowing as cold as it normally would, please give us a call. Don't wait for it to go completely off for that. So let us know if it's not working, especially if it doesn't feel like it's getting as cold, so we can come and check it out. Thankfully, today is the last truly hot day, and hopefully we will get a reprieve for a while before we see some more trickle ditches. Palm tree pruning will begin on campus on June 2nd, so you'll look for some folks shimmying up those palm trees to clean out some of those dead leaves. And then also wanted to let you know about home care service. So there's been some questions about what is home care service going to look like going forward. And we understand that that is an important service to have available to you. So TSJG will have some minimal services available for home care going forward. They can do very minimal assistance with things like bathing, housekeeping, assistance with activities of daily living, like dressing, etc. Maybe cooking and meal preparation, obviously escorting to appointments or companionship. These limited services will be available for up to 4 hours a day, Monday through Friday, and they will have a 2-hour minimum. If we do not have team members available, your one-stop shop will always be Valerie S. So if you would like to get some additional service in your apartment, you would simply call Valerie, describe what your needs are. A licensed nurse will come do an assessment, help you determine what type of care you might need, and then Valerie will either coordinate with that with our team members here that we have available, or to coordinate with an outside agency. And that's really not any different than what we've done historically. So I just want to make sure folks know most of our home care services that have been provided by, at San Joaquin Gardens have been outsourced to agencies because we don't have enough of an on-call pool to provide service, especially those that want it 24 hours a day or extended periods. We've always outsourced that. And so this is to give you the assurance and understanding that we're still here to help coordinate to do those assessments. We will have some minimal home care service available, but for some of the extended services and weekend service, we just don't have enough team members to go around right now. So we would be helping you to outsource that to one of the local home care agencies. But again, we would help with all of that. So the most important thing to remember is if you begin needing assistance with home care or any activities of daily living in your current home, that we understand that, and we want you to remain in your apartment for as long as possible as well. And just to give Valerie a call, and she will help coordinate assistance for you. In Lifestyle Rich, I want to remind everyone that the summer scavenger hunt has begun. Everyone receives scavenger hunt card in their message box. The challenge is simple: find the 9 summer symbols. Why are they making this so hard? Find the 9 summer symbols around campus and fill out the card with the location that you found them in. They are tied mostly to trees. Turn in your completed card to the concierge desk by June 17th, and everyone who fills out their card will be entered to win a fabulous summer gift box. So enjoy your scavenger hunt. We also want to remind everyone to Step Into Fitness Challenge. It's still continuing until Sunday, May 31st. All of those that participate will be put into a raffle, not just the top steppers. So keep up the great work, keep getting those steps in, and remember to step into fitness. Resident Spotlight, our kindness rocks. So our very own Joyce Aiken and our Mimi Shishmanian were interviewed by local art journalist Donald Monroe, and they're turning rocks into treasures. You can catch the interview on Touchdown Channel 88 or read the full article at www.monroereview.com. So this Thursday, Friday, and Saturday at 11:30 a.m. on Channel 88, you can see our very own Joyce Aiken and our Mimi Shishmanian being interviewed regarding their beautiful kindness rocks. And a big thank you to Joyce and our Mimi for all that they're doing to spread some joy throughout our campus. Just a friendly reminder that there is no Pooh Fairy employee here at the terraces at San Joaquin Gardens, so please clean up after your dog. If your dog poops, you must scoop it up, even if no one dares see you. We received an increased number of complaints about owners not picking up after their dog. Often the dog is doing their business on the sidewalks, so please be a good neighbor and clean up after your pets. Upcoming birthdays, we want everyone to wish a happy birthday to Faye Lowe's on June 4th. An interesting note for all of you, so some TSJG trivia. The month of June has the least amount of birthdays for TSJG with a total of only 13 birthdays. So these are a very elite crew, so make sure to wish Faye Lowe's a happy birthday on June 4th. Finally, we are reminding you all that the hunt for the gnome continues. The gnome will be relocated every Friday morning, so call in your sightings of the gnome by 5 p.m. each Wednesday night. A winner will be drawn live on the Thursday neighborhood Zoom call. So with that, Dennis, are you ready to pick the winner?
I'm here.
All right.
You will notice the bowl is smaller this week. We only have 5 people.
Oh my goodness. People
According to
couldn't find it.
Michelle.
Maybe people
So-
couldn't find it. It was so well hidden this time, maybe.
Well, it sounds like it was pretty obvious out in front of the Grove.
Well, maybe it's too hot.
Okay, so we only have 5 names in here. One of which is my wife. And if she wins, she has insisted that I do call her name. So with that said,
Oh, my good marriage.
well, I think it's only appropriate that our champion walker, Ruth Kallenberg, is this week's winner,
Oh,
since she probably has walked by the gnome more often than anyone else.
that is very true, Dennis. Well, a big congratulations to Ruth, and we will be bringing you your cookies so that you can enjoy those after all those steps. So with that, congratulations. Everyone continue to get out there and look for the gnome, and so you can be entered to win as well. WHO is the organization that's renaming the coronavirus to COVID-19. WHO. So if everybody remembers, now who made that? Is it Abbott and Costello? Who made that original? Who was on first joke? I don't remember now. I'm not sure. But anyway, I'm going to stop sharing my screen and we'll stop recording. And thank you all for